I think I'm going to dive in. But just to say, I'm going to talk a little bit about the sort of rationale for the work that Blackfriars is doing around its research institute and observatory. Nathaniel will talk a bit about the work he's doing on some research with colleagues at King's. And then Tamanda will talk a bit about the work that we're doing in Birmingham. So there's a kind of mix of things, a mix of kind of empirical research and some conceptual stuff. And then we'll have a conversation. Okay, so let me start by Yes, okay, so let me start by giving you a sort of bit of a background here. There are 140 black professors in the United Kingdom, and there are 164 universities, meaning that there's not one black professor for every university in the country. And of course, if we take any sort of intersectional view here, the Higher Education Statistics Authority don't publish data which is any combination of characteristics. So we don't know currently what the number of black female professors are, but we know that in 2015 there were 17. Even if we triple that number, obviously that's still diabolical. There are 0 black professors in senior management positions in UK universities right now. And this compares unfavorably to every other industry, every other profession in the country. It's similar to the situation for FTSE 100 CEOs, but at least for FTSE 100 CEOs we had one for quite a long time, meaning that we had 1% then compared to 0% for higher education. Only 1% of UK RI principal investigators were black, and black students make up about 3% of first-year PhD students across the UK, but there's a huge amount of variation in this, and at some universities, at some times, in some departments, the number is 0. Only 1% of UK RI student funding, right, so this is for PhD scholarships, etc., went to black students. Some of you might know all of this already, but the point I'm trying to make here is that if you meet a black person in an academic job, they are likely to be the first something. The first PhD student in a department. The first PhD student to get funding in a department. The first PhD student to complete. The first black person to become a faculty member. The first black person to get significant funding. The first black person to become a full professor. The question is that okay? There's only a few of you here, so you can say no. So that can't be okay. So we have to do something about that. Nevertheless, I am talking here mainly about diversity in a kind of professional sense, which is clearly important as a matter of sort of basic fairness, but it contributes to another pernicious problem, which is about the marginalization of black people's contribution to knowledge production. So this can take many forms, starting with basic participation. For instance, a huge concentration of research participants among weird populations. So that's among Western, educated, industrialized, rich, democratic populations. Lots of people have now started to drop the Western and replace the W with white, which is also likely to be the case because lots of research, most research takes place in a small number of highly successful, you might say, universities in terms of their research output. There's a kind of egregious way in which this manifests itself, because oftentimes it's also the case that research participants are only the students at these super elite universities. So the second problem, though, so that's a problem about like who participates the second problem really is in relation to the questions that we seek to answer. And over the horizon of 50 years, very little research has been published in the academic literature about race at all, which means that the people are not asking the questions, or the questions are not seen as worthy of publication. The authors of this paper Roberts et al., they conclude that author race plays a key part in lots of these diversity issues because authors of colour are more invested in communities of colour, more cognizant of the importance of racial diversity in participant recruitment, and less likely to rely on a predominantly white convenience sample. This sounds plausible to me, but it means something about increasing our understanding of race via the first problem that I talked about, by changing the way, the nature of the people who are able to take up academic positions in a university. So finally, I want to mention very briefly, I was given a short talk, and I made an argument that was along the lines of we need to start to get people to think about how they conceptualize race before they start to do racial diversity programs this time. So we need to get people to understand something about constructivism, something about essentialism and so on as a starting point to intervention. And the feedback that I got from that is, you live in the past, mate. No one believes that race is biological anymore. Sorry to tell you, friends and family, lots of people still think that race is a kind of biological reality. And this is just one example. I didn't give the authors of the paper because I don't want you to go and try and read the paper. But this paper, this is the abstract of a paper that was published in 2012 and only retracted in 2020. In 2020, this paper was retracted. I'm going to read it for you. We review animal studies that have found darker pigmented individuals average higher amounts of aggression and sexual activity than lighter pigmented individuals. We hypothesize that similar relationships between pigmentation, aggression, and sexuality occur in humans. This is published literature. This is published literature. Okay, so that's what some people, not all, some people in academia are talking about in relation to race. And then there's a question about evidence. Okay, so, I've explained that there's little in the way of research on race, and I should say that there is a negligible body of work on race which is focused on black people. There's a difference between saying this paper is about race and saying this paper is about black people's experience. Okay, there's a difference between those two things. Holding that in mind, whilst at the same time accounting for the UK's long-standing preoccupation with evidence-based policy creates a conundrum. Okay? I'm saying that there is little or no evidence on black people's experiences, whilst at the same time the UK is focused on evidence to inform policy. Okay, so this is, just hold that for a second. Colleagues at Blackfriars probably don't know this yet, but we're doing a bit of a study on trying to quantify this evidence-based policy. And from our research, and this is definitely work in progress, don't take this out of this room. Well, it's recorded, so listen, we're working on it, okay, we're working on it. From 75,000 government policy documents, we could only find, via machine, not by eye, but via machine, we could only find 43 total scholarly citations. Okay, just hold it. It is widely accepted that black people are persecuted in this society, although people may use other kinds of language, and it's accepted that most people think that something should be done. But how do we know what to do if policy must be based on evidence and there is so little evidence? there's also another kind of thing going on. So there's evidence-based policy, and there's also something else which I and others refer to as policy-based evidence-making. Okay. So I don't know if you've seen what was it called? The Commission on Racial Equality or whatever, right? The Sole Report. You've seen that. This is like the prime example of policy-based evidence-making. Here's the policy. The policy is there's no racism. Now go off, find some evidence to show that there's no racism going on. Okay, so we have a bit of that. And there's another thing about evidence, and I'm really kind of stuck on this word, evidence, is in the way people talk about it. So we've seen, and you're going to hear a lot about Stop and Search today from me and others, but we've seen, a chair of police federation saying, I have not seen any evidence. What's happening here? I have not seen any evidence that this Stop and Search is a large systemic problem. We have to start to have a bit of a push and pull here, and we need to start to push back a little bit on this kind of narrative. Okay, probably taking up too much time, so I'm going to hurry up. So what we're going to do, what we try to do, we're trying to end the era of first. I don't want to... Look, there's something good about it, right? You're the first person to do blah, but we need to stop that. Okay? We've had MPs, black MPs, since 1990s. We've had black lords since 1960s. Okay? We've had a black president of the United States, and we don't have a black professor who's head of a university? Really? Is this where the conversation is? So we want to end that. So we're going to start to push on that. We need to develop and support the development of primary research. We say there's no evidence. We're complaining that there's no evidence. Well, then we need to go and produce some. Okay, that's partly our job, but it's partly a matter of also supporting what's going on out in the world already. This is not about saying that everyone else who's not at Black Prime is not good at doing research or they haven't thought about these questions. Lots of people have been thinking about these questions, but we need to try and coalesce and bring some of that together. And in line with that, we need to kind of collate and communicate some of this existing high quality evidence which is there. So some stuff is there. So, it's not that no one thought about this before, we're the first people to ever think about black people in research, but it's a question of bringing that together, giving people a home, right? If a university doesn't love you, we will love you, and we will support your research. And we need to do all of that together with black communities, holding them at the centre. So, the vast majority of people that are employed by Black Thrive are black. We have lived experience of our blackness, of going through this world as a black person, and we need to allow that to have force in our empirical research as well. Okay, and how are we going to do that? So, we need to collaborate. I've talked about collaboration a little bit. We need to collaborate with you, but we need to do that in an equitable way, okay? We're not here to collect data for your study. Okay, sorry about that. Good luck. Good luck with your research. We hope you find some black participants, but that's not our job. We're not selling data, we're not selling people's information, we don't do that. But if you have questions that align with the questions that we have, then we're happy to collaborate with you on those questions and on that data analysis. And maybe, if it's right, we will also help to gather participants for these studies, if we are able to have an equitable position in your research project. Okay, we need to, I know this is a trope by now, and I'm sorry to repeat this trope if you're one of those people that dislike it, but we need to do some decolonization. Decolonization needs to go on. So, a lot of what I said earlier around the weird problem means that a lot of academic research is assumed to apply to new populations, even when that hasn't been tested. And a colleague of mine, Geeta Reddy, she's not here, but I hope she would have been here, but a colleague of mine, Geeta Reddy, wrote a paper recently where she says the hegemonic Western approach to research gives the impression that their observations originate from nowhere in particular, and therefore apply to everywhere in general. No. No. Sorry. We have to stop that. We have to get away from that kind of model. So we have to subvert that norm and denaturalize that position, the position that what I know must therefore apply to everyone else. And finally, we don't care about methodology wars, okay? We don't care about that. We care about emancipation. The question that you ask and the results, what comes from that question, can be emancipatory or not. The method is not emancipatory, okay? So it's not about, quant is better than qual or qual is better than quant. We don't care about that. We care about what the question is and what tool is required to answer the question, which is why we have a team of quant and qual researchers, okay? So we're interested in emancipation. Okay, I think that's the end of my words, but these are, the slides are on there and they're on here. Oh, that is the end. Oh, here we go. So these are some of the people you're going to hear from Nathaniel in a minute. Nathaniel is employed by King's and works directly with us at Blackfriars. You're going to hear more about that partnership as we go along, but it's important and it's different to have this kind of connection. And Nathaniel's our community research coordinator. That's me. I didn't introduce myself. My name's Celestin Okoroji. I am a postdoc for a little while longer at the London School of Economics, where I teach the social representations course as part of the social and cultural psychology master's degree, and I'm the head of research at Blackfriars. Very privileged to have that position. You'll hear from Tamanda Walker shortly, who's our Qualitative Research Fellow, a really amazing critical ethnographer who's come to just blow up our dashboardification of knowledge. And then you have Jolyon, who has COVID, so he can't be here. But he's our quant research fellow. He finished his PhD not long ago at Sussex. Sorry, I didn't say Tamanda's just about to finish up her PhD at Leeds University. That's us. That's our team. That's who's trying to do this. We need more. We need help. We need people. We need friends. We need money. We need all kinds of stuff. I'll be grateful to talk to you guys about that later on. Okay.
Hi everybody, as Celestin has kindly introduced me already, I'm Nathaniel Martin. I'm the Community Research Coordinator at King's College Centre for Society and Mental Health and Lambeth Blackfriars. I should really focus. So I am leading on the Stop and Search project, which Celestin mentioned already. We know how much Stop and Search, well, I say we, the black communities know how much Stop and Search affects young black people and black people altogether. And this is something that's gone on for decades. It's historical, even right now, where we are in Brixton with the 1981 uprisings. But I think a big thing, what we're trying to do at the centre and at Blackfriars is saying, what are we going to do about it? So here is what we're proposing. So it's a priority for many, many people, Blackfriars being one, the centre as well. But Lambeth Council have seen it as a priority, and it's a part of their Made Safer strategy, looking at not just violence amongst young people, but state violence as well, from the police. And it's also part of the May's recommendations from November 2021. So we're also looking to develop academic research, understanding the mental health implications of Stop and Search. We're also looking not just at the academic side, but some impact as well. So we're looking at developing training for the Lambeth and Southwark Met Police. We're co-designing that with young black people from the borough. And we're doing similar things with Lambeth community members. So if you're interested, come and chat to me afterwards. One of the brilliant things about the partnership between the Centre and Blackfriars is, the sharing of data. And the Centre have brilliantly undergone the REACH study, which is a study examining what influences mental health amongst young people over time. This was done in Lambeth and Southwark amongst 4,000 young people. Some of the REACH staff are in the room, big up you. And this was for 11 to 16-year-olds, and 85% were from ethnically minoritized groups. Some of the stats I'll be sharing now are still currently in preparation. Sam Davis is working on this, she's in the room somewhere, big up Sam, wherever you are. But as you can see, 1 in 7 young people that had been going through the REACH study had been stopped by the police. And that number is even more stark with 1 in 4 boys, and boys being 6 times more likely to be stopped and searched by girls. Through the REACH study itself, this isn't just data from the Met Police dashboard, but this is data strictly from the REACH study. We're seeing that even though Black Caribbean, the data set is 85% an ethnically diverse group, we're still seeing that Black Caribbean boys are more likely than any other ethnicity as a part of the study to be stopped and searched. And when we look at the comparisons, 1 in 3 Black Caribbean boys compared to 1 in 11 white British boys being stopped and searched, and you start to ask yourself these questions: why? Why are they being stopped at a higher rate? And then we look at the mental health impact from a numbers side of things. Those that have been stopped by the police are showing signs of higher mental health impact, so more mental distress, more externalizing problems, more internalizing problems, even more self-harm. So we are seeing that stop and search is having a massive effect on our young Black people, and those problems are becoming even more evident through their mental health. As a part of the REACH study as well, there's been some workshops with young people from the study, and these are some of the things that they flagged up. And after you guys have taken this in, I'll be sharing some quotes and themes that have been coming through some interviews and focus groups that we've been running as a part of the study as well. Right, so these are some emerging themes from the interviews and focus groups we've been conducting. So amongst the young Black people that have been interviewed and part of the focus groups, there's a genuine fear of the police as opposed to seeing them as a service to help them and support them. There's a stark awareness of how they're perceived by others, by the police, by wider society. And here's a quote from a young Black mixed race man. He says, "Stop and search shows me and tells me where I stand in society. That I am Black before I am anything else. I can claim being mixed race, but you, the police or society, are going to treat me like a N-word." Stop and search leaves young people feeling traumatized, angry, sad, fearful. I don't think that these are feelings that young people should be feeling from our public service. We're seeing that multiple stops are leading to, are being seen as trauma as well. Many young people are wary of the police ever since they were stopped and searched. There's a change in perception of the police. A lot of young Black people that we're interviewing don't necessarily disagree with stop and search per se, but after they've experienced it themselves, they have a totally different conception of stop and search and the police force altogether. And overall, young Black people understand that stop and search should be a normal occurrence for them, which leads to a desensitization of stops and searches, which is really disappointing. There's a large number of young Black people that I've been interviewing and just chatting within the community who are like, I don't even bother telling my parents, I don't even bother taking a slip from the police because they know that highly likely it's going to happen to them again. One last quote I want to share with people. This young Black man says, "After I was stopped and searched, I was quite depressed. I didn't really want to speak to anybody. For a couple months, I didn't really want to speak or talk, especially if I hear someone speak about that subject. That will just get me vexed." Doesn't know what vex means, it means angry. And yeah, this young person also mentioned just messing around with their friends and a bit of rough play fighting, but having flashbacks to being roughed up by the police and that affecting how they start interacting with their friends as well. I think that's it from me. Again, we're doing action around this, we're trying to change this, we're trying to challenge the system. So yeah, it's not just going to stop with the academia, we're going to meet academia and real life. Thank you. Pass back over to Celestin.
Yeah, sorry. Thanks for that, Nathaniel. I am presenting this now on behalf of Jolyon because he has COVID. And I took way too long before, so now I'm really going to try and speed through it, and I'm not going to look at my notes. So we're going to talk a little bit about Stop and Search as well, some work that we're doing at Black Thrive, but we're developing now a collaboration with KCL, including the REACH data, which Nathaniel just spoke about. So look, I talked about the police chief saying that there's no evidence for systemic racism. There's loads of evidence, come on. Labby review, all kinds of reviews. McPherson report, EHRC have put out how many different reviews saying that there's systemic racism in policing, and the use of stop and search in particular is problematic. Okay, but lots of the research that's been done on stop and search in the past has relied on one of these three things. Either you've done this stop and search research via FOI. So you've FOI'd the police for the data. You've said, please send me this stop and search breakdown of who you've been stop and searching. Or the state has empowered you to do some kind of review. So this Labby review is like the state says, go and review this stuff. Or, you know, you've got some sort of connection. Maybe you have an institutional connection because of your university, or you have some kind of personal connection, you're able to do this research. Okay, having said that, police data is open. Okay, it's openly available, openly accessible. You can get to it, but only if you know some data science, basically. So you need to have some data science skills to be able to get to that data. And then there's huge problems, as Nathaniel can definitely give you anecdotes about, in terms of the way they present these findings. And actually, the only police force that presents their findings is the Metropolitan Police. So all other police forces don't have any data dashboards or whatever. Okay, so what's Black Thrive doing? We're doing a public service. You guys should really be grateful, because we're making this data actually publicly accessible to the people, and we're trying to present it in such a way as you know, people who don't have a background in data science will be able to understand. And of course, that paves the way for new research for you know, other academics and just other citizens. Okay, so this is the Met Police's dashboard. If there's data science people, quant people in the house, ooh, this is interesting. Okay, so first of all, what does proportionality mean? Is this what is intended to be presented? How proportional stop and search is, or are we really interested in disproportionality? Right. This is the first. The first more kind of qualitative question about what is trying to be presented here. Okay, so that's about search proportionality. And then we have, this data is presented just by pure volume. How many people were stopped? Okay, there's also a question about whether or not that is interesting. Or, and watch the lines now, or whether or not it matters what happens in terms of the number of people in the population. So if we have per 1,000 people in the population, what changes here? What changes is that it goes from white people being the second line to being down at the bottom. So none of this is explained. Okay, so if you don't know anything about statistics, you don't know anything about, you know, how these graphs are made, can be confusing, can give you the wrong picture of what's going on. Okay, so what have we done? We have developed some code, some algorithms, to extract this stop and search data from the police API, and importantly, we've organized it by place. So it involves a kind of range of technical queries and so on, which is outside the scope of this meeting. Nevertheless, what you need to know, we need to take from this, is that from today going backwards, we can get 36 months of stop and search data. Every single stop and search broken down as one person, one row. You were stopped, we have you on a row, some demographics about you, where you were stopped, what time you were stopped, what they stopped you for, whether or not there was any kind of outcome. All in all, 1.5 million searches that we're trying to analyze. 1.5 million stop and searches that we're analyzing. Okay, this is broken down by all of the local authorities in the country, essentially. And from that, we can replicate their dashboard, but with a different lens. This is what's important about Black Thrive, Black researchers looking at this data, because we can use a different lens to look at this. We are not here trying to get the police to look how proportional they are. We're trying to show what the disproportionality is if it exists, okay? So here we go. So this is disproportionality. It's the same graph, essentially, but the red lines in the middle, and these are represented on the Y, are the disproportionality between black and white people. And what you see is that it's essentially a stagnant straight line. You're 5 times more likely to be stop and search if you're black in Lambeth, okay? You couldn't know that from the other graph that you saw. But that's just a kind of basic descriptive question, and we can ask other slightly more inferential questions. So for example, what about all of London? Okay, so these are odds ratios for every borough in London. Okay, so this is how much more likely a black person is than a white person to be stopped and searched in different parts of London. Okay, again, this is still descriptive. However, you can start to think about other slightly more complicated questions. It seems, from the eyeball test, the places where disproportionality is highest. Oh, does this have a little? It's got a thing. Where disproportionality is highest are in the places where black people are least likely to be. Okay, this is Richmond and Merton, and I don't know what this one is. Jackie, do you know what one is? Okay. I'll tell you one more interesting tidbit. Okay, if you know how the police are organized, they're organized in something called borough command units. Borough command unit don't cover one borough though. It covers 2 or 3. It's like a little region. All of these 3 areas are controlled by one person. Okay? This leads us to a different sort of conversation about what do we mean by bad apples. Do we mean on the road, police bad apples on the road, or do we mean higher up the hierarchy, for example? We could also ask some more kind of theoretical questions. What does this mean about the contact hypothesis? What does this mean about psychological distance? What does this mean about intergroup relations, etc.? We can ask other kind of more complicated questions, but nevertheless, at a basic level, this didn't exist before, and it exists now because we just worked with the data that's already there, but we passed it in a way that makes it usable for people. Okay, here's the rest of England, so we can do it everywhere, really. This also brings up kind of other interesting questions. You can see that there's lots of kind of disproportionality in other kind of weird areas. I would say for people who do like criminology or police research, that kind of thing, there's something here about maybe county lines going on here. So it's some kind of coastal areas and so on where things are worse. But it's also interesting to note that there's not a huge number of black people in certain areas, right? Some of these ones that don't have any colour, that's because the number of black people in the population is nearly nil. So we can think about like where do we need to concentrate our time, energy, etc. when we're thinking about these questions, just by doing this sort of analysis. And making this sort of analysis available to other people. So for people who are interested in data science and so on, all of this data is on GitHub, or the code is on GitHub as well. Okay, and then, because it's so granular, we can go down to like the time of day. So we can even say, what time of day are black people more likely to be stopped and searched? And what areas are they more likely to be stopped and searched in, for example? So people who are from Lambeth will kind of know what these areas are. But essentially what this is showing, I don't have time to go into too much detail about it, but what this is showing is that disproportionality varies by time and place. Okay, it's not just a kind like you can do it at the level of here's the general disproportionality, but it's also like at what time of the day are black people safest from being arbitrarily stopped and searched, for example. We can start to have that sort of conversation. Okay, that's it.
At the end?
Yes, thank you. Please hold your questions to the end. Tamanda.
Okay, good afternoon, everyone. There's definitely some pandemic people that I've only seen on a Zoom screen, which is kind of weirding me out, but it's nice to see you all. Okay, so picking up from what my colleagues have already shared, I'm going to take this in a slightly different direction. We've got actually some really, really interesting insights from our research on stop and search in the boroughs that I'm looking at, which are at the moment Haringey, Birmingham and Lambeth. And there is plenty of connection to be drawn between the data and the dots that you're seeing here that Celestin has mapped out about the time of day and the things that we're finding when we start talking to black people in the community about their mental health and what it means for them to have to exist in a world where they either experience stop and search and the threat of that, or see their loved ones go through it, their children go through it, etc. My job at Black Thrive Global is to focus on the qualitative research. In other words, what is actually going on for black people behind these numbers. And this data is super important because, as Sal said, it helps us to figure out where to concentrate our efforts and who we should be talking to. I'm going to be honest, as black people, we usually already know that because we know our environments, we see around us, but it does help us when we're looking for funding from institutions who may not know to really point to the fact that this is the problem, and we have the data, your data, systems data, to show you what is actually happening. Okay. In my work, one part of my work, I'm working on a program or a project called Thriving Futures. So just to give you a brief bit of context, Thriving Futures is a big lottery-funded program which was funded in 2021 and which provided us with $5 million over 10 years to explore the experiences of black communities in Haringey, Birmingham and Lambeth, as I've said. I want to mention this bit about the 10 million, the 5 million funding over 10 years. It's actually not enough when you break it down in terms of what we actually need to do. However, as Sal said, we are in the era of firsts. And this is the first time that we can think of that a black-led organisation has had money for research that is sustained for 10 years. That's a massive deal because we're not having to worry necessarily about what we're going to report in 2 or 3 years' time. It means we can take a longer-term approach to the work that we're doing. So it's not like we have time, but we have a bit more time than we would otherwise, which is really, really important to us. And also, critically, it means that we have time to do the work on building the relationships in each of those localities that we need. So we are a partnership collective, and we're made up of Black Thrive Global as technically on paper the lead partner, but within each locale, we have to take a specifically localized approach. We can't do a one-size-fits-all thing. Black people in those areas know what's going on in their communities, and they should be setting the agendas and the priorities and determining what we do. So in each locality, we have Black Thrive Lambeth, who obviously know this area very well. We have Mind in Haringey. Interestingly, their stop and search data is much more troublesome than Birmingham that I'm going to go into. Black people in Haringey are 9.5 times more likely to be stopped and searched by the police than their white counterparts. And because we can track that down to time of day, we know it's happening in black communities. We know that section 135 and 136 stops where you can be stopped on the street and taken into a mental health institution, or police can have a warrant to come into your home, remove you, and section you, are active in particular areas, and they are black areas. They are on particular streets, which of course the community know, they tell us that, but we now have the evidence for it, okay? And so in Birmingham, our final partner is Catalyst for Change, where the priorities that we're focusing on there have been slightly different. We are focusing on stop and search. I hate to say that people say sometimes, oh no, Birmingham's quite good on stop and search because black people are only 2.5 times more likely to be stopped and searched, but that's still not good enough, and we're still seeing the mental health impact of that in our work. So in any case, based on this context, our aim is to put black communities at the forefront of reimagining what our futures should look like, and co-creating a society where systemic racism and other oppressive systems have been dismantled, and crucially, ensuring that we can live lives in which we thrive and are not suffering the adverse mental health and well-being complications that arise from these kinds of systemic practices. I'm going to skip this just to say that, just to follow through from what my colleagues have already said and give you a little bit of a tiny showcase into some of the qualitative research that I've had a chance to look at in Birmingham. So just as with our quant team, we are I guess, working with a conception of decolonizing that means we are taking data that the system has gathered and putting it to new use. So our conception of decolonizing is about liberating data from the sources it currently stands, often in systems that we can't access. I'm not a coder, I'm not a quant person, I don't understand, I'll be honest, I don't understand a lot of the graphs. I need someone to explain that to me. But once our team have extracted that and explained it to me in simple terms, like black people are 9.5 times more likely, I get it and it makes sense for me, and most importantly, it makes sense to the communities that we are in conversation with all the time. With our qualitative data, I've recently been doing something very similar, where I have taken healthcare data collected by the NHS, which I will show you, and I have reanalyzed their data in order to put it to the purpose of improving black mental health in Birmingham, and crucially to take it back into the community and ask them, what do we want to do about this? Does this make sense? How do you feel about this? Which is a missing process in the way the system's data is currently collected, where often black people are asked for their data and then there's no accountability structure whatsoever in terms of what then happens with that. So in the first 6 months of our 10 years in Birmingham, we've done quite a bit of learning in this process. Unsurprisingly, we found there are really high levels of suspicion in the black community about data and research. We have found that the data that currently exists is being used to maintain the status quo. Again, this probably won't be surprising to anybody who's a sociologist or just has their eyes open. Racism has been systemic and pretty enduring. But the example that I will give you is the NHS Trust basically commissioning new research and new data, frankly poorly designed, collecting that data, and crucially they are commissioning and instrumentalizing black-led organizations to collect the data that they do not have the trust in the community to do. So in the project I show you, the NHS first tried themselves to collect data from from service users that were in the NHS's care, and then found that they actually didn't have the skills, the relationships, the trust, or the ability to speak to black people. And so after several false starts in their research design, they then got our partner in Birmingham to try and collect this data, and we went about it in a different way. So what the research they commissioned was intended to do, the Mental Health Trust there wanted to explore black service users' experiences of care within the trust. Now, I don't actually know what these individual stories were who contributed. It's perfectly possible that some of these people themselves would have been subject to stop and search. We have stats on data. We don't know enough about their stories, but this is a start in trying to understand some of the experiences and how people have ended up in secure units. So they were asked in focus groups about times that staff had really helped, times when things hadn't gone so well, how they felt staff responded to them and considered their race, culture and gender within their treatment. And they were also asked more broadly what their ideas were in terms of improving mental health services within the black community. Again, I want to stress here that the research design in question came from the system. We would have asked probably very different questions. The approach to conducting the research, as I said, there were false starts. But the key thing I want to put across here in terms of what our capacity is the significant difference between the way that the trust analyses and interprets the data and what we do. Because we are not in the system, we're not being paid by it, we don't really have that much of an investment in upholding it, really, except to the extent that we can get proper care from it. So there's several things that we've pulled out in our analysis that I think are really important to highlight. And the first of these, which comes from these 6 focus groups, is that again and again in the data, when you look at it, the service users that we spoke to spoke continuously about liberation, freedom, wanting to be out. This is not something the trust picked up, because obviously their job is often, yes, it is about well-being and recovery, but it is also, to some extent, to keep people in the system. So we see this word, release, discharge, people saying constantly that they want to recover a sense of well-being in the community with loved ones. and they want freedom to come and go from the ward. The implication of that for us versus the trust is, well, why is so much care delivered on ward? Are there other models in which care could be delivered in the community, and what does that mean about the way people are trained? There were obvious examples of care being done well. So those tended to be when people felt treated humanely, they had a sense of connection, and conversely, that they were not being treated like a child, they were being treated in ways that kind of went beyond a file of paper or scripts. So the biggest complaint was being treated like a tick box exercise and that there wasn't real care. And in some of the most distressing things that were shared with us, adverse well-being was becoming worse because of abuses of power. So there were people who told us, I know I'm over time, aren't I? Just bear with me. There were people who told us that they had observed staff, in their words, triggering other patients to get a reaction out of them, and just that vicarious trauma of watching this was really unhelpful to their recovery. Two points on this, just to say where we do align with the NHS's trust analysis is proactive approaches to race, gender and culture do really matter, and people said that again and again. They also did say, obviously, that there are attempts to do a lot more since BLM, and that sometimes it seems like people don't know where to start. The intention is there, but they don't know how to go about doing it. There was something, again, we align with the trust on the need for it's a workforce issue, there need to be more representative staff, people who look like them. People told us about being able to open up to therapists for the first time because they looked like them and they felt they would understand their experience of disadvantage. But critically, where we really start to diverge from the trust is we are willing to look at the findings in terms that essentially raise questions about what the trust is doing at a very, very fundamental level. So we were told a lot by people in care that this Western biomedical model, it was more than cultural competence, right? There needs to be better interpretation of spirituality. There's a lack of cultural choice. People said that talking therapies, they couldn't talk about their religious or spiritual beliefs or things that made sense. And so they said to us that systems change needs to take place at every single level. Even if you get a staff member that is all right, in their words, they are not the ones that make the decisions. And they said to us that we need to think about solutions across the system. And so this is shaping absolutely every aspect of what we're doing with our research work there going forward. I know I'm out of time, so I'm not going to labour it too much more. But I would say there was a very gendered dynamic where the group of men in the secure unit that we went into were absolutely clear about how angry they were about the kinds of research that had been done before. How people collect data, never report to them, there's never any accountability, why do they never receive feedback, and telling us that they wanted to give their voice. So we were a little bit unsure how we would be received in Birmingham when we went in to a big assembly very recently. But actually what we've discovered is that black people really do want research. They just want research led by black people, and when they can trust that the analysis will reflect their experience. So that's where we are at the moment. There are lots of plans afoot in terms of our research. We've got data clubs, actual members of the community who want to collect their own data and analyse it and take it from the system. We weren't necessarily expecting that, but that's already where we are within 6 months. So we've got a big job on our hands, and hopefully we can tell you more about that at another point, but I will wrap it up there in the interest of time.